$1,000 to the good.
I understand what you're saying. I mean, I think what, you know, in order to, with the revenue shortfalls, if you have to honor the 16 million and you have to come up to the table with another 300,000 out of the reserve fund to make that 16 million, hey, you know, the shortfall in sales tax and the shortfall in the economy basically cost the county $300,000 out of its reserve fund.
When we were setting the budgets with the sheriff this year, when it really came down trying to guess when those prisoners came back, if you'll early on, he was saying he was going to get 8 months.
Right.
We ended up saying he was maybe going to get 4. Well, he's not even going to get 4.
To Dan's credit, you said October.
Be sitting at $700,000 instead of.
I mean, and to Dan, your credit, you were saying maybe not at all, or October. Yeah. So, I mean, I understand.
It's less than what we thought.
I mean.
But see, the booger of it is, you know, what we have to shell out of general revenue goes up by it bites us twice, because if there's a $2 million budget and they only bring in 1.5 million, that costs me $1 million, because I have to honor that commitment, and then I have to show that I gave them, I have to spend that $500,000 twice on paper. And the likelihood of Marshall's prisoners coming back to our facility this year, slim to none. But we do have immigration prisoners. And
9 or 11 or something like that?
10, 12, 15 in that neighborhood.
At $55 a day, so it's
$50.
roughly
No, I understand.
$600 a day.
I mean, we don't have the 39 or 60 that we once had.
Right.
Wouldn't it be great if we did?
Right.
Yeah.
Well, it'd be great if sales tax is up 5%, but this is the reality of this economy. We made that commitment, and we have to honor that commitment.
But we're not going to go over whatever budget was set. We may have to move money out of reserves to meet.
We're going to have to transfer more money than we.
We hope to not go
expected.
over, but till the end of the year, we're not going to.
But that not going over will depend on every other department within general revenue coming in well under.
It will.
Right.
No doubt about it.
Yeah. And at the end of the year.
And chances are we might be over for the end. We knew that when we gave him that money.
And at the end of the year,
speculating on prison.
If we're over budget,
we did.
That's cold hard fact of life. I mean, we're scrambling, trying not to go over budget, trying to save money here and save money there. But if we go over budget, or we have to make more transfers than we budgeted, that's the reality of it. Because if we say we don't have the revenue, everybody's got to give $10,000 so we can prop the sheriff up. Because there's already, you know, a sentiment, you know, everybody wants to crack the sheriff up as a bad guy right now. He's under budget, and he's got some prisoner revenue, and he cannot individually control when those Marshall prisoners come back. Once upon a time,
And he has no control over sales tax.
LETF used to give money to general revenue for years and years. They gave money to general revenue. Now they're asking for a little back.
Can I ask you, I need to ask you actually a question about something that, as I was kind of doing some research, and I wasn't aware that this was in the budget, but there is a budgeted transfer also from the sheriff's revolving fund to law enforcement trust.
Right.
And I guess, I wasn't even aware that transfer was budgeted. So I guess my question is, let's see, and it was $58,866. When does that come into play?
Are we sure that he's not taking part of it? Has he already transferred some of it in there?
No, that hasn't been used. However, when I look at the sheriff's revolving fund, I don't know for certain that was budgeted to come out of revolving fund, because he had a $73,966 budget there, and
Is the
So I don't
revolving
know if
fund
that
one that he doesn't have
58,000
to
is part
submit a
of it.
budget on? Isn't that the one of his that he can spend without a budget? Or am I thinking of fines?
No, sheriff's revolving, well, I think he should do a budget on it. He doesn't have to have anything
Approval.
prior
Right.
approval. But I'm just questioning,
When was that,
When does
when are you
that-
saying that was put in?
It was in the budget originally. It's in the line right underneath our transfer of 400, it's 58,000 and some change from his revolving fund. We just have to ask him, see what he intends to.
So I guess
Right.
maybe
That's
that
to be
was
spent
just
on
a,
certain,
And-
all that
and
can be
that's-
spent on is training and various things like that. It can't just be put in and paid. If you look at it pretty deep, a lot of his training money and stuff that's inside his budget is coming from that, I bet you.
Right, he's paying bills out of the revolving
but see,
fund now.
part of his revenue that was
Some
budgeted in
maybe
law
it's training
enforcement
bills,
trust
right?
included
Yeah.
that $58,000 transfer from sheriff's revolving. So that's why I'm just,
We just have to ask him, say, hey, when's the $58,000, when do you intend to make that deposit into, because this isn't the first or the last, well, it is the first, but not the last. Well, it's not the first transfer, it's the first transfer that's coming out of house money.
There's a statute that says he can only have 50,000 in that fund, and when it does go over, then we transfer it out. That's what
no, I
that is.
think that's civil, is that civil?
It's revolving too, it's got the same, you have to look it up.
So have we transferred any money out?
It's not over yet.
He's not been over yet. Just have to call him and say, hey, we've got a $58,000 transfer budgeted here. What, yeah,
I did call him last week and asked him if he had any money he thought he was gonna get in that before the end of the month, and they said 18,000 for prisoners, that's it.
Right.
And that wasn't gonna cover
Right, and that's probably our first, have we gotten any prisoner,
it. It's the second check.
second check, first one was about the same amount
Yeah, but they
probably?
don't pay it every month, it's like every
Right,
other.
right, they pay here and there and they pay in arrears. So
Yeah.
conceivably, some of our prisoner revenue, we're going to house the prisoners this year and it will be
Next year.
next year before we actually see it. We actually had a deposit in January for about $40,000, I think.
And that was from November.
Right, it was old prisoner revenue. But let's see, about 8. Yeah. How far apart were those two checks spaced?
We got one, actually, we got one right after they had the prisoners, and that was, he told me they got that right away because that's like a good good payment, saying they're gonna pay, and then they wait. He said, we may not get another payment until January.
Right.
That's what he told me on the phone
It
last
comes
week.
trickling in. So his revenue is probably pushing $100,000 right now for prisoner revenue. Federal prisoner revenue, state prisoner revenue is to the moon, which is a good thing and a bad thing because they eat and they get sick and we're on the hook for all of that. And we get $19.45 a day for them. That doesn't even begin to cover their expenses. But just check with the sheriff and see what his plans are as far as transferring that out of the revolving. Any more comments?
I just have to agree with you that I don't think the money ought to be transferred out of 911.
There wasn't gonna come out of 911's fund.
All right.
It was gonna
It was
come
gonna come
out
out of money that
of
would
money
go.
set aside to
Wouldn't
send over.
necessarily come out of 911's fund.
But that's a,
Yes, ma'am.
Oh, and then this is not related, this is another. Have you made a decision on the methamphetamine, the Benadryl?
No, we actually, today at 11, a gentleman by the name of Jim Gwinner from CHIPA, the Consumer Healthcare Product Association representing the pharmaceutical industry. He and a couple other gentlemen came in and gave us a presentation. They represent, we had the evening upstairs where we had the people that are in support of it. We had them come in. They chose not to do a public forum. They chose to come speak directly to us, and we listened to them. And then our third step is going to be to have hopefully a big public hearing upstairs where we'll have both sides, hopefully a decent PA system where people can come up and, in a moderated environment, come up and ask questions, and we'll give both sides an opportunity to answer questions better than, because Matt gets questions, Jim gets questions, I get questions out in public, and unless I have the documents with me, I can only give fair answers. But yeah, we haven't, and I don't know, 2 weeks, 2 months, sometime. But I want to have that before we even sit in here and debate whether we want to pass that or not.
Okay, so that'll be announced in the journal or something?
Yes.
Okay.
Yeah, we'll put that in the journal, put that on the website, because we only had 25 people at our other hearing, and the presenter said that was remarkable. He said usually there's 5 to 10. He said you'd be glad you had that turnout, but I'd like to multiply that by 10. I'd like to have a room full. I mean, think about it. We're making a decision that for 52,000 people, and I've heard from 50.
You want to hear from anybody today?
Yeah.
You want one more
Yeah,
opinion?
we still have time.
Oh, well, I'd be very much opposed to nixing it, the sale of Benadryl for everyone.
Well, it wouldn't be nixing the sale, it would make it where you had to get a prescription.
No, I know that. I mean, make it difficult for people with a need for it, an honest need for it, because of criminal activity. It would be a shame.
And I agree with Sue, I'm opposed to it as well.
What do you think about it, Bob?
Well, what would it entail? You know, you would just go to the drugstore and be able to pick it up off the counter, right?
No, you'd
Yeah.
have to have, it would be.
That's how it is now.
That's how
They're
it is.
wanting to make it where you.
That's not how it is now, though. You still
Can't
have
go
to do a
behind the
log.
counter.
Right. Yeah, you have to get it from behind the counter.
It's
but
better
you
than
can
that.
buy- Right now, we have a system in place that you can buy. You can go buy 3 boxes. Everybody in this room can go buy 3 boxes a month. But the second you go to buy your 4th box, all of the states are networked together, and it kicks out and says Bob Padella.
Bought one too many.
Actually, it won't sell it to you, I don't think.
No,
it
It'll
denies it.
stop you.
Yeah.
And then the
so
police can get legally now.
Then
The
the-
police can.
the police will say, Bob Padella tried to buy that 4th box, and so they hang around you and they notice you don't sniffle a lot, so they think you're up to something.
Yeah,
Well,
take
let
a girl.
Let me ask the question. It's behind the counter. Yeah. They take your name?
Show ID.
Yeah, you have to show your driver's
Okay,
license.
let's say you need a 4th box. Let's say you are a legitimate user of the drug for municipal purposes and not for the other.
If you follow the label instructions, you can't take 3 boxes a month. You're actually allowed to buy more than what you can use. If you eliminate the people who have heart disease and the people who are under 12 who aren't supposed to take it, the amount of Benadryl or pseudoephedrine products that they sold, it worked out to about, I think, a box for every person and a half in the entire state of Missouri. Because you can buy more than what you can realistically, if you follow the instructions, John.
I was here this morning. When I left, I said, what if we pass this in Lincoln County? That we make it so it's prescription only. The problem then gets passed up to Pike County. So, I say a person doesn't want to go to their doctor, doesn't want to make an appointment, drives up to Pike County, buys a box, goes through the thing, and then drives back here. Are they going to be a criminal bringing it back here?
I wondered that too this morning.
He said
He said something in that vein.
Well,
He
he
was
said
over-
he said about Boone County. Say if I go to a Mizzou game
He said
and I
that.
pick up
I started asking
a
him.
box of it.
Well, it's going to become a commodity. He's afraid somebody's going to see it, and because
That's kind of how I ended up taking
it's
it. But he
worth-
made it sound like it would be illegal for him to take it without that.
Would it be illegal to possess it here? I mean, I understand, that it is very effective. I mean, it's in almost a lot of things you take. I mean, if you get a head cold and it's a Sunday night and you say, I'm going to run to Walgreens that's open 24 hours and you grab a bottle of NyQuil, it's in there.
Mhm.
I mean, the doctor is not open,
Right.
so I was just curious, is it going to make criminals out of people that buy it in jurisdictions that don't regulate it like that?
I don't think it addresses the possession of it. It addresses the purchase of it.
He meant someone will break in his car.
Yeah, but possession's still
But
not
here's
the
what's
law.
taking place.